Well, here's a term for you. It's called digestive motility. Not exactly something that we're all familiar with. It actually refers to the movement of the muscles and the nerves that work together to digest the food in your system. So usually we never really hear about it because our system doesn't have problems. But sometimes our children have abnormalities that can cause some common issues. So CHKD specialist, Dr. Orhan Atay, is here with us today. And to get the exact title, because it's so important to be able to say this exact title, you are the Director of
Neurogastroenterology.
And so what that should tell you is how much the brain and the gut are involved, to the point where you have married the specialties to be able to help children with the symptoms of this. How does the brain work with the gut?
So the bowel, the digestive tract itself, is actually highly complex, and there's just an incredible amount of innervation. So the nervous system is wired in a very sophisticated manner to the entire digestive tract, and that's going to affect the movement or the muscles that surround the different aspects of the digestive tract.
Okay. And so you see it in children with different conditions like spina bifida, Down syndrome. Why is that?
Well, so spina bifida is a great example. So the primary thing we see in that condition is that children will have problems with constipation, fecal incontinence. Because the spinal cord is affected, the nerves are affected as well that innervate the digestive tract, specifically the colon, for instance.
So that's more of the nervous system side of things with those children. Talk about when they always tell you when you go to the doctor and you vaccinate your children, this isn't anti-vax or anything like that, but just to understand how it works when they say, oh, your child may have diarrhea after being vaccinated. Why is that, and when should that become a concern with your child, that it's not just a normal reaction?
Well, there's a lot of causes for diarrhea. I think the most important thing is the degree of diarrhea that the child is experiencing. Certainly, if it's a large volume and they're not able to keep up the fluid intake, we'd worry about dehydration.
Okay.
And most of the time, diarrhea is self-limited, so we would consider it an acute diarrhea, and it should get better over time. If it's not getting better and it's protracted course, definitely you need to seek help and potentially go to an emergency department if you suspect your child is dehydrated.
Is it ever a reason to not get a vaccination, depending on what the reaction is with the bowels?
The only true indication to be hesitant about a vaccination is if there was potentially some type of allergy that the child might have a reaction to. Outside of that, I would support getting all vaccinations.
All vaccinations. Is there anything else that you want to add about when parents should make a call to you, the specialist, versus just waiting for a bug to pass, for example?
Yeah, so so I am primarily a gastroenterologist. I'm the director of the Neurogastroenterology Program, but the vast majority of the times the child will be seen by their primary care provider, and they will start some testing and some treatment potentially. And if things are not getting better, and it's primarily a digestive disorder that we're concerned about, then they will make a referral to our division at CHKD. And we can get children in pretty quickly. So within a week, you should be able to be seen if need be.
Great to hear. Dr. Atay, thank you so much for being here with us today.
Thank you.
All right, we'll be right back.